Hello everyone. Welcome to Enzyme MBBS, where complex medicine becomes simple and exam ready. Okay, so without wasting any time, let's get started. Coming to the introduction, wound healing is a complex, dynamic, and well coordinated biological process. Efficiency and outcome of wound healing are strongly influenced by several local and systemic factors. These factors may either promote, that is, accelerate, healing or delay, that is, impair healing. So understanding these factors is crucial for predicting healing outcome, preventing complications, and improving patient management. I hope you understood by this simple reading itself. It's all our straightforward sentences. Next, coming to the classification. Now, factors affecting wound healing can be classified as factors promoting wound healing and factors delaying wound healing. And under promoting and also delaying, there is, like, you can divide them into local and systemic factors. So coming to the local factors that promote healing are, first thing is good blood supply. If there is adequate blood supply, it will provide oxygen, nutrients, growth factors, and inflammatory cells. Even in the process of wound healing, we discussed many certain growth factors are necessary for proper wound healing, and basically good blood supply is the source which actually provides it. So that is very much essential, and it promotes angiogenesis and collagen synthesis, essential for granulation tissue formation. We discussed in that video that how much important granulation tissue is and what are all its function. So basically good blood supply is a key point. Next thing is adequate oxygenation. Now oxygen is required for collagen synthesis and hydroxylation of proline and lysine. So obviously we need adequate oxygen supply for it, and it enhances bactericidal activity of neutrophils, because while discussing about how the phagocytosis happens, we discuss about respiratory burst. So there are free radicals, superoxide anion. So for all that, oxygen is required. So it promotes the bactericidal activity of neutrophils. Next, coming to the third point, it is proper wound apposition. Now, what is wound apposition? It is basically how the wound edges are aligned. If they are properly aligned without any gaps, then the healing would be faster. But if the wound edges are separated, or there are multiple wounds with edges marked differently, then it takes longer time, the wound healing delays. So we need a proper wound apposition. So that is basically correct alignment of wound edges, which promotes healing by primary intention. Now healing by primary intention itself is a 5-mark question. We're going to discuss about that in a separate video. And it reduces granulation tissue and scarring. Now you may ask, see, granulation tissue is very important, we discussed. So why are you saying that reduced granulation tissue helps in proper wound apposition? Granulation tissue is necessary, but there is a proverb that too much is too bad. So if there is no one to control it, it will grow excessively. So we need to control, we need a proper amount of granulation tissue. So proper wound apposition basically reduces the granulation tissue, and if there is too many, wound edges separated, then the granulation tissue will also be excess, so scarring will also be more. So all these things comprehends the proper wound apposition. Next, aseptic conditions. So obviously we don't need any infection to give more complications. So absence of infection reduces tissue destruction, because if there is sepsis, if there is infection, then tissue destruction will be more. So aseptic condition reduces tissue destruction, and it prevents excessive inflammation. Obviously inflammation happens when the infection is there, right? Next, immobilization of wound. This prevents repeated trauma, allows proper collagen deposition, and especially important in fractures and surgical wounds. This you may have seen in many hand fractures, or whatever there is fractures, we usually cover it by plaster of Paris and we make it immobile. Why? Because this is the reason. You need proper rest. You don't need to move that. If you move, then the wound healing would be delayed. So immobilization of wound. All these are the local factors which promote healing. Next, coming to the systemic factor. First thing is adequate nutrition. Under nutrition, there are various materials which you need. First thing is proteins, which is required for collagen synthesis and cell proliferation. Second thing is vitamins. Now vitamins, one is vitamin C and another one is vitamin A. Vitamin C, even we discussed in the previous video, it is essential for the collagen synthesis. It is essential for the enzymes which are responsible for the hydroxylation of proline and lysine. It acts as a cofactor. And one more is vitamin A, which is essential for epithelial regeneration. Coming to the minerals, especially one mineral has a very significant role, and that is zinc, which is essential for DNA synthesis and cell proliferation. Next, the second point is normal hormonal status. It's like growth hormone and insulin promote the healing, whereas corticosteroids, it is an anti-inflammatory drug, right? So if it is present excessively, then it also delays the wound healing. So absence of excess corticosteroids. And the third systemic factor that promotes the healing is young age, because in young age there will be better cellular response, there will be faster epithelialization, and it will result in efficient angiogenesis. Next, coming to the factors delaying wound healing. See, if you have studied any one thing, like if you studied the promoting wound healing, now in delayed you can just reverse the things. We there spoke adequate blood supply. If there is poor blood supply, it will delay. We spoke there aseptic conditions. If there is infection, it will delay. If there is foreign bodies, it will be delay. If there is no proper wound reposition, it will be delay. So you can just modify it and write, or else if you can remember this, more than remembering, if you can understand, you can direct it. So let's go see one by one. So first thing is infection under local factors. So infection, it causes persistent inflammation, and it leads to tissue necrosis, and bacterial toxins may degrade the collagen, and it increases the wound dehiscence. What is wound dehiscence? Wound dehiscence is basically it refers to the partial or complete separation of wound edges after they have been closed once. It's like a wound is closed, but again it leads to the separation. That basically bacteria can do that. So that is what we call as wound dehiscence. We learn more about wound dehiscence under complications of wound healing. Next is poor blood supply. So reduced oxygen delivery, impaired angiogenesis, and it is seen in peripheral vascular disease or diabetes mellitus. You have definitely come across this, that in diabetes mellitus wound healing is delayed. Why? Because there is poor blood supply, or there is reduced oxygen delivery. And next, foreign bodies. Now foreign bodies like sutures, dirt, necrotic tissue, they act as needles for the infection, and they prolong the inflammation. Next, excessive movement of wound, again disrupts newly formed tissues, causes repeated trauma, leads to delayed healing. And one more thing is size and site of wound. Obviously, larger the wound, slower it heals. So it's a universal law, we can say. And poor healing in areas with poor vascularity like lower limb and over joints. Next, systemic factors. So first thing is malnutrition. See, there we discussed adequate nutrition. So here malnutrition, protein deficiency, reduced collagen synthesis, vitamin C deficiency, scurvy, defective healing. Why defective healing? Because collagen synthesis is impaired, because we need vitamin C for hydroxylation enzymes. Next, diabetes mellitus, again impaired leukocyte function, reduced angiogenesis, and increased susceptibility to infection. Aging, reduced cellular, there we said younger age, more the cellular proliferation. Here reduced cellular proliferation, decreased growth factor response, and slower epithelial regeneration. One more is anemia. Again in anemia, oxygen delivery is suffered, so it leads to impaired collagen synthesis. Steroid therapy, there in the hormonal system we discussed, there should not be excess corticosteroids. So now steroid therapy is given for some other causes. Now that will inhibit the inflammation, so that results in decreased fibroblast proliferation, that results in decreased collagen synthesis, and that results in delayed healing. Systemic infections and chronic illness like tuberculosis, malignancy, chronic kidney disease, all can result in delayed wound healing. And last but not the least, smoking, which causes vasoconstriction and reduces oxygen delivery. This results in delayed angiogenesis. Now angiogenesis is again another 5-mark topic which we are going to deal in another separate video. At the end, you sum up with a clinical significance. So identifying delaying factors basically helps in preventing wound complications, as well as it reduces the hospital stay, and it improves the surgical outcomes. And correction of systemic factors improves healing. So that's all for this video. I hope this was useful. So learn it and do well in the exam. Keep reading, do well. All the best. Thank you.